Hey, and welcome back. This is next week's episode. We are here. We're talking about medications you can use this week to help control your allergy symptoms. Hi, everyone. I am Dr. Salima, board certified allergist, immunologist, mommy to four, here to just give you some tips on how to deal with this year's allergy season. Okay, so last week's episode, we talked about things that you can do that are not medications to sort of decrease your allergen exposure. But say you've implemented those things, allergies are really bad, and you walk into your local Rite Aid, Walgreens, pharmacy, wherever, and you come to the medicine aisle for allergies, and you're like, where do I start? Okay, so first thing, 4 cardinal symptoms of allergy: nasal congestion, runny nose, itchy, watery eyes, sneezing, followed by things like postnasal drip, itchy, scratchy throat, itchy ears. If you're having symptoms more than a couple days out of the week, I would recommend starting a steroid spray. Okay, so what is a steroid spray? Well, common examples of a steroid spray are things like Flonase, Nasacort, Rhinocort, Nasonex. If you take the box and flip it over, it will say that it's a glucocorticosteroid. Now, the purpose of a steroid is to decrease inflammation. So inside of our nose, if we looked at nasal anatomy, a lot of what is inflamed, it's called your turbinates. So when you inhale the pollen or inhale whatever you're allergic to, these turbinates get really large and inflamed, and they produce a lot of mucus and histamine and things that make you really, itchy and snotty and sneezy and unwell. And so being on Flonase decreases that inflammation, and it sort of shrinks that turbinate size, okay? So overall, you're gonna produce less mucus. Now, the caveat here is Flonase doesn't work magically with one use. It doesn't work. It actually takes time for it to get its sort of maximal efficacy. So I usually tell patients, so for springtime allergy sufferers, I usually recommend a couple weeks before your seasonal, triggers start, prime your nose and start that nasal steroid spray. And actually, studies have actually shown that if you prime your nose, which means a couple weeks before your trigger season starts, and you start that Flonase, overall, your quality of life is going to be better throughout that allergy season, and you'll end up using less medication, okay? Now, say you've tried that particular nasal spray. There is another nasal spray that you can add on or try first. It's called a Astelin, which is a nasal antihistamine spray, and it works very well. It is actually approved down to use in young kids as little as 3 years of age. And I will say the biggest complaint that some of my patients tell me is that there's a bitter taste that they get. Not everybody gets it. I think it's some genetic makeup in your particular taste buds. The common question I get is, can the Flonase and the Astelin or the Astapro be used together? Absolutely, they can. You can use 2 separate sprays, or sometimes your doctor might prescribe you something called Dymista, which is basically those 2 sprays in one. But basically the idea is it's 2 medications in one, in that one spray, okay? Or you can use the 2 sprays separately. The other, great thing out there, which are antihistamines, so your Claritins, your Zizals, your Zyrtex, your Allegras, and generics of all these are just fine. Now, Benadryl, it popped out of my mouth, you'll see. Benadryl, I try to stay away from, or diphenhydramine. Anything that's a first generation antihistamine that is sedating and doesn't last 24 hours, I stay away from, because now we just have great second generation antihistamines. And these work well because they have a 24-hour effect, okay? So these are some medication options. Now, of course, if you've tried the environmental control measures and over-the-counter medications, definitely try your local friendly neighborhood allergist, because, they can perform testing. They can actually go ahead and add on other medications. And then finally, your allergist can actually offer even allergy shots or sublingual immunotherapy, which are tablets to certain things that you may be allergic to. I know it's wild, but it's so amazing. Next week's episode, I'm going to talk a little bit about allergy shots. What are they? And sublingual immunotherapy. What's that all about? I hope you enjoyed this week's episode. Thank you so very much for joining me. Again, if you like what you're seeing, please leave a comment, give it a thumbs up, let me know, because again, I do this in my spare time and I love educating the public. But I kind of want to know if you like these videos or not, and if you want to hear more videos of this. Next week's episode is going to be part 3 of allergy sort of treatment. Last week's episode was environmental control measures. This week were some medications that you can do over the counter. And then next week, we're going to talk about, if you end up in the office of your allergist, what are these allergy shots and what is sublingual immunotherapy. All right, take care. Until next week.